Can you continue to get filler and possibly avoid a facelift? How long do they last? So what do I think of cheek filler? Should you ever fill under the eyes? And I don't want to step on anyone's toes, but I always do in these videos. What do you think I'm going to say? What do you think I'm going to say to that? Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as you feel. We did this very interesting thing not too long ago. I asked a question on stories, which is, ask me anything you want to know about fillers. We got a ton, mind-blowing amount of questions. And so what I've done is I've taken 15 of the probably most relevant, most common questions, and I brought them here on YouTube, and I'm going to answer them one by one. So what we're going to do is we're just going to simply go through, in no specific order, 15 catch-all questions related to fillers. And I think you're going to find the answers to be useful and helpful along your journey as you navigate, what you should do and when you should do it, etc., when it comes to filler use. Let's break it down here. I've got it on my phone right here. All right, so question number one. Can you continue to get filler and possibly avoid a facelift when you get older? So this is maybe one of the greatest misconceptions when it comes to the use of fillers. No one's at any fault for this, by the way. You have to understand that fillers have been around for about 20 years now. And frankly, I think we all were very confused about what exactly are they going to accomplish for us. And I think what we've thought throughout this time and at various points, we thought maybe it could do more than it actually could. So in other words, maybe facial aging, all that laxity and everything else, maybe it's really just dependent on the deflation. Maybe it's this like the grape turning into a raisin phenomenon as you lose volume on the inside. What ended up happening was basically, as a result of that, we started using fillers for just about everything. I mean, we started really pumping up faces with filler, with volume, various and more advanced type of fillers came around, after a period of time, we realized, people are still sagging and their necks are still, getting loose, and no matter what combinations we do and what areas we do it, it's not really changing the fact that people's sagging aspect of aging is still happening. So the answer, in my opinion, after all of these years, is that 100% you're losing some volume in your face. And we'll talk more about that in some other questions. But you are not losing volume and then sagging. The sagging aspect is just happening, and it's really more or less related to the hormonal changes that typically happen somewhere in the late 40s and early 50s. And whether you've done fillers or not, you're still gonna see those changes. That's why people are less and less satisfied with fillers when they get into their 50s. So the answer, long-winded answer to your question is that fillers will not slow down or keep you from needing a facelift in the future. All right, let's go to the next question. Should you ever fill under the eyes? 100%, it's okay to fill under the eyes. The problem is people fill too much under their eyes. I did a whole video on lower eyelid aging issues and how to manage them, basically the treatment and rejuvenation of the lower eyelid. I suggest you watch. But there's more going on to the lower eyelid than just volume loss. So if you make a mistake of putting too much filler under the eyes when you actually have bags under there, or when you actually have excess skin, or when the face has come down and there's like, there's a tear trough and a malar groove forming and all this kind of stuff, you're not going to be not only happy with it, but you're going to be requiring too much filler, and too much filler in the lower eyelid area can really screw things up. So the bottom line is small amounts, and I'm talking about like 0.2, 0.3, that's like a quarter of a syringe to a third of a syringe of filler under each eye in the tear troughs is all you should put in there. And really the best candidates for this are somebody who's in their like mid-30s or something like that, just got a little bit of volume loss in here, looks a little tired, put a little volume in there, does wonders. But you get older, you got compounding issues going on, the filler by itself won't cut it, and then if you try to put in too much of it, like a cc under each eye or half a cc under your eye, you're gonna get things like Tyndall effect, puffiness, swelling from the absorption of this stuff, because they love water, and makes everything look worse actually. So I'm not a fan of high volume fillers under the eyes. In fact, even when I do a fat transfer, if those other conditions are involved, I always combine the two. I don't use volume by itself. All right, so the next question. Can filler be used to fill lines around the mouth? We're talking about smile lines for the most part, probably an extension of the nasolabial fold. I'm not gonna get too hard on the nasolabial fold, but I think it has been like the greatest misdirect in the history of cosmetic procedures. Like We all have nasolabial folds. Children have nasolabial folds. They're not a target of aging. Putting a bunch of filler in them doesn't accomplish anything. When the cheeks do come down, the nasolabial folds do get deeper naturally as everything starts to crowd around the mouth. But I think what this question is about the smile line. So smile lines, you can put a little bit of filler, but you should put it very, very carefully. You don't put too much, because if you put too much, it'll fill on either side of the line, because the line is being formed by the attachment of the skin to the muscle. There's an attachment under here. So when you smile, it pulls the skin down. If you put too much filler into this area, not only will it not accomplish anything, but it'll actually make the areas around it look thicker. And a lot of people have suffered from that. So just a tiny little bit, very superficially, but usually perpendicular, meaning like injected into this direction of the skin, to just give a little bit of plumpness back to the dermis, where the dermis has folded and broken as constant creasing during smiling, can go a long way. Very delicately though. All right, next question. How long do they last? Another one of those live and learn type situations. You know, the companies all told us it would last like 6 months, a year, whatever, and it'll all go away. Well, guess what? It doesn't go away. It doesn't go away completely, I don't think, in any situation. So what ends up happening is there's always like a layer, a portion of the filler that literally lives there and resides there for the long run. The problem with that is if you add more and add more and add more, you're stacking the filler over time. And then you get what is effectively like a permanent change in that region. Now, it's great if it's what you want, but if you don't like it, you're kind of stuck with it. So here's how to think about it. Don't overfill in any situation. Realize that less is more when it comes to volume, and learn the difference between what is sagging and what is volume loss, and therefore you won't try to push the boundaries of what a filler should do, knowing that if you do and you're dealing with something that can lead to long-term effects. And this is not my opinion, by the way. There's MRI studies that have like confirmed this. There's patients I literally go into, other surgeons go into, that have had fillers in their face like 5-10 years, and you get in there and it's like oozing out of their tissues. It's there. It's stuff stick around. So be aware of that. It doesn't completely go away. Next question. Do you dissolve fillers before facelift? And if so, how far in advance do you dissolve it? So the answer is I only dissolve it in one area, and that's under the eyes. Because if you start to try to dissolve it in the lips and the cheeks and the jawline, temples, you'll never get exactly where it was injected in the first place. And as a result of that, what ends up happening is you get lumpy, bumpy, wavy deformity throughout the tissues, because some went away, some didn't. Now I know some surgeons are out there and dermatologists are using ultrasound to like pinpoint where it is and then put the needle right into that spot. It's a process if you try going down that road. By all means, go down that road if you wish. I mean, it's a lot of enzyme to be putting in there to dissolve the fillers, as well as a lot of sticks and time and everything else. But I mean, if it's something that you're really motivated with, that's what I would look for. I personally don't recommend it for my patients, and I certainly don't do it. I do remove it under the eyes at least 3 or 4 times a week for our patients who come in for surgery, and I want to replace that filler with a fat transfer. Everywhere else, I just leave it alone. Next question, do you suggest filler in the temple to lift the eyebrows? What do you think I'm going to say? What do you think I'm going to say to that? No, I don't agree that's a good idea, because too much volume in the temple will certainly look like too much volume in the temple. The reason the corner of the brow is starting to sag is because the entire fascia of the side of the face is starting to sag down. So putting filler into that area to try to plump it up is not a great idea. Some people I've seen, they're putting it inside the temporal hair tuft in this area, and I feel it, and there's like this almost like a golf ball in that area, because they're putting this volume to displace. Now, from a physics perspective, from a displacement point of view, that concept does work, but look what you have to do. You have to basically create like a, God forbid, a tumor to be able to lift up the tissues and move it out of the way. That doesn't jive. That's not like an anatomic thing to do. So really, again, laxity and sagging should be treated with surgery. Volume loss, which does happen in the temple to some degree, should be treated with volume, but it should be done in a very, very conservative and gentle way. You don't need to be perfectly filled or even convex in that area, but just not like deeply hollow. It looks more healthy. So the question, where do I recommend getting fillers and how often? So this is what it comes down to. I do fat transfers literally every day when I do my surgeries, my vertical restores, etc. And I have always, for the last 20 years, used fat transfer in conjunction with my surgical approaches. My notion of where fat goes has been significantly refined because I understand more and more where volume depletes in a face and where volume should be added. So here's my 2024 consensus knowledge of what I think volume should do and where it should go. So let's start in the upper face. It should go in the temple. You lose a little volume in the upper eyelid area. You lose a little volume in the lower eyelid area. You lose a little volume down here along this part of the jawline. We call it the pregial sulcus. You lose some volume in the lips. Generally speaking, those are the main areas. Sometimes I'll put some here. We call the precanine fossa, which is just sort of this like area where you lose a little bit of bone and soft tissue. This can get a little extra deep. Those are the typical areas where I think a little bit of filler can actually go a long way. But reality is the filler looks the best on people with a firm soft tissue base. So somebody who's in their like late 30s, maybe early 40s, but just lost some volume, want to put a little volume back. Try doing exactly what I just said in somebody who's in their 50s or mid 50s and have this like laxity effect going on, which is synonymous with being in your 50s. The filler will literally look like nothing even happened. It's not worth doing. That's just my opinion. I don't even do fat transfer on those patients anymore. I don't even do fat transfers on people who are in their, generally speaking, in their 40s alone, because most people in their 40s are starting to see some laxity, and then they're going to think that the fat transfer didn't do a good enough job to restore things. So it's not even that. It's just things are sagging. But if you put it in the areas that I just described, at least you're not going to get into the deformity issues that happens when you start putting a bunch into your cheeks and a bunch into your jawline, all of which you're trying to do is exactly what we talked about in the temple scenario, is try to lift and displace. But imagine if you have to form a golf ball in your temple to lift up your brow, which is so close to it. Imagine how much filler you'd have to put in your cheek to try to lift your jawline and neck. I mean, it would be absurd. So people quit before they get to that place. But I mean, on their way over there, they end up looking like, an avatar. It's like, we've seen that look all over town. It's not good. All right, next question. Can you use fillers to address the laugh or marionette lines? I think I answered it a little bit above, but basically very superficially, very small amount. You can't get rid of a smile line, which is a laugh line, because it is there every time you smile, unless you're planning on not smiling or laughing, which I don't think is a great idea. So, accept the little lines that happen when you smile. Now, for people who think that the smile line or those lines next to it, when that happens, that's not just from smiling, that's from your face loosening up. You want to prove it to yourself, grab a hold here and lift up your face going this way, and you'll see all those lines kind of smooth out. But then hold it up as tight as you can and then smile, and you'll see you still form a little crease here. So that's a different issue. You can't get rid of it with filler. You shouldn't even try. Maybe soften it a little bit if everything else around it is nice and firm. All right, so the next question kind of confirms what I was saying earlier. So I got lip filler 4 years ago and it won't go away. Is that bad? Now, lips are actually an area that for most people, the filler does kind of like dissipate pretty quickly because the mouth is moving a lot. There's, a lot of activity. So it doesn't typically hold volume, but always will leave a base. Again, everywhere it's injected, it'll leave a base. Back when I was injecting, using fillers and things like that, I would see patients back and they would think just because it's been 6 months or 9 months or a year or whatever that they should redo it. And I look at them and it's like, yeah, you redo it, but it's not nearly what it was, a year ago. It's already like, you've kept a substantial amount of it. So you put like a little bit to top it off or whatever it is. But bottom line is this person who had it in there for 4 years, is it bad? I guess it's only bad if it doesn't look good. Then yeah, it's bad. It's never good when something you don't like is there, long term. But if you really hate it, the nice thing about most of the hyaluronic acid-based type fillers, like Restylane, Juvederm, and that whole category, is that you can put enzyme in and diminish it. So, obviously I told you it can create irregularities, but it can be done. So you're not like stuck with it forever. The problem is when you use like Radiesse or Sculptra, then you're kind of stuck. Or if you go to somebody to do fat transfer and they don't do a very good or natural looking job, then you're stuck. So next is my thoughts on fillers in the chin. I actually think, a little bit of chin augmentation with filler is a great application actually for people who have a little bit of a small chin. Putting a little bit of some structural or thicker type of a filler, for example, Voluma, into this area is really nice because it brings the chin out slightly, and it's a simple procedure. It's a lot easier to do than a chin implant. Now, it might not be as robust and it might not obviously, last in a consistent way the way a chin implant would, but certainly for a little augmentation, it looks pretty there. So my thoughts on fillers in these horizontal necklines, and I don't want to step on anyone's toes, but I always do in these videos. I know I always upset a lot of practitioners and injectors and whatever, but I don't mean it. I'm just giving you my thoughts and my opinion. And you as a potential patient and consumer, you got to make your own decisions. My opinion is it makes zero sense to put filler in these horizontal lines. And the reason is, just as I described it in the smile line, it's the connection between the skin and the platysma muscle. And that's what is holding this area up. So you try to put filler into this area, the filler goes on either side of the connection, and you end up creating these basically like ridges over that fold into the line and make the line actually look deeper. The line is supposed to be there. It's there in almost everyone. It's deeper in some people than it is in other people. Yeah, you could potentially do what I said, like a little perpendicular injections, very dotted, very, very minor. Maybe make it a little bit better, but if you're, again, in your late 40s and early 50s and your neck is starting to come down, that's gonna make that area look heavier because then the skin is gonna fold over those skin muscle connections and it's gonna look deeper. All the filler in the world is not gonna do anything for that. The neck skin, along with the muscle, have to be lifted back up into position to make that area look better. So select situations. I wouldn't get overcomplicated with that. It's probably not worth the battle. So what do I think of cheek filler? Now this is an interesting thing. This is where my complete opinion has honestly changed based on my understanding of what anatomy is when I started doing deep plane lifts like the vertical restore, because what happened is I used to do this all the time. I used to put a little bit of fat in the cheeks. I did that with my filler patients. I put a little bit of cheek filler, and I thought having a little bit of fullness there was the right effect. Problem is, again, in the face that is sagging, this cheek that is now here causing this area to be voided so that you put the filler in this area, this cheek belongs up here. So you can do this to yourself. If you pull your cheek up like that and all of a sudden it looks like your midface is fuller, putting volume into that area is putting volume into an area that doesn't actually need volume because there's no real volume loss that happens in the cheek. The cheek does come down, creating volume loss. The real answer is you got to bring this up. Now, let's say you're not in a position to do a facelift and you just want to kind of soften that area. Put very small amounts. Don't try to go for that rounded effect. That's one of the first areas where faces get kind of tweaked looking. Same thing for out here. You don't want to have too much volume out in this part of the cheek because it'll make your temples look more hollow. It'll make this area below and in front of your ear look more hollow. If you have high cheekbones naturally, don't add more volume to this area. It's going to look off. If you don't have high cheekbones and you want to kind of like cosmetically enhance it, yeah, of course, put a little bit of filler, again, like a volume or something like that to give a little bit of strength because you're going for a cosmetic effect. And that's okay as long as you're artistic and delicate with the whole process and you don't overdo it. Are there some people who metabolize fillers faster than others? I suppose there is. I've heard that all the time, like, oh, I run a lot, I exercise a lot, and I lose whatever you put in here. I guess that could happen, so it's a possibility. It's hard to say because what's happening at the tissue level is the minute this stuff enters the tissue, your body is trying to break it down. And some people might be more efficient at doing that, and therefore they would. It's not metabolism in the way, I don't think. I mean, I don't know what exercise or metabolism has to do with it. I think just some people are more efficient at mounting an inflammatory or an immune response to break it down. That's what I can think of. All right, so the next question, will your face sag when fillers dissolve? So here's the deal. If you have a lot of volume in your face and the fillers diminish, there's a potential you'll see some laxity enhanced, right? But there's a rare situation where people have so much volume in their face that it functions like weight loss, right? Like the Ozempic face situation where like you lose 30 pounds and all of a sudden you look like you've aged 10 years. That's not gonna happen with fillers. First of all, as we mentioned, there's a base that sticks around forever. Usually people aren't putting a lot of it everywhere, it's like in specific areas. And the fact is, if your face was sagging, it's gonna sag with filler in or without filler. So the bottom line is, I wouldn't worry about that, whether you're planning on dissolving it or whether you're worried about it going away. You get into your late 40s, early 50s and beyond, your face it's gonna sag. I mean, let's just keep it real and understand like our battles that we're gonna be fighting if we choose to fight them, but that's basically the story behind that. All right, so the last question, are all fillers dissolvable? Very, very good question. So all of the hyaluronic acid fillers are dissolvable by an enzyme called hyaluronidase. It's basically breaks down hyaluronic acid, chews it up and melts it away. But if you use fillers like Radiesse, if you use biostimulators like Sculptra, there is no reversal agent, there's no way to remove it. Kind of a spin-off of that is, does it break down your normal hyaluronic acid? Well, of course, any hyaluronic acid around is going to be affected by the enzyme, but the fact is that your body is naturally producing hyaluronic acid on a regular basis, so I wouldn't worry about that aspect of it. I think the bottom line is whatever filler is there is getting broken down. The natural hyaluronic acid, even if it does get broken down, hyaluronic acid naturally doesn't live long in tissues anyway. I think last time I read or checked it, it was like 24 hours. It's a constant recycling of natural hyaluronic acid. These fillers are macromolecules, essentially. They're like engineered so that they don't break down on their own, but they break down with enzymes. So good news is you have, generally speaking, a reversal. You can't get that with Radiesse, with Sculptra, and obviously you can't get that with fat. So at the end of the day, be careful what you put in there, be mindful of where you're putting it. I hope this video helps give a little bit of guidance around it. And just for the record, I am not opposed to fillers, period. I just, again, my knowledge in 2024 has evolved about where volume fits in, the battle plan and the toolbox for addressing facial aging and doing it in a good way. So bottom line is, I'm sharing that information with you guys ultimately to help you make good decisions going forward and not find yourself, bummed out about some effect that you've had with some procedure, etc. All right, guys, I hope you all enjoyed that. I hope you share this with some friends and family. Let's get the word out. Let's get the education out. If you haven't already, subscribe to the channel. If you enjoyed it, hit like. And if you have any questions or just want to tell me how great of a job I did or how bad of a job I did, drop it in the comments below. But it's been a pleasure sharing this with you guys. And if you want more information like this, guys, subscribe to my Karam MD Journal, which is a newsletter. It comes to your inbox once a week. I think you'll find the info super, super interesting if you like facial and skin rejuvenation topics, which I assume since you're watching this. All right, guys, take care.